academic institution with a vision to address and extend academic needs of the community, most especially in its neighboring metropolis. The institution has its major mission to address educational convergence following the Philippine agenda of the government, which is to make an intervention in the achievement of quality education of the region and in the Philippines as a whole, in accordance with the pertinent provisions of Republic Act No. 7722, otherwise known as the Higher Education Act of 1994 and the Virtual Resolution No. 160-2019 of the Commission on Higher Education. This government permit number 012 series of 2019 is hereby granted to Jose Maria College, Sasa, Davao City, Philippines, to operate and conduct the Doctor of Medicine program. The Jose Maria College of Medicine Foundation is now ready to serve everyone, especially the community. Jose Maria College, being a non-sectarian, a globally competitive school, and is well known for its world-class facilities. As the school vies for excellence across the globe, it ensures to provide assured, consistent, and quality education. The Jose Maria College of Medicine Foundation is the third newest school of medicine in Davao region. With the vision and mission of the institution, the Jose Maria College of Medicine Foundation offers a scholarship program, especially for the unfortunate, underprivileged, deprived, competent, and deserving individuals expressly manifest their intention to study and finish their health education. Let us all welcome the newest School of Medicine, the Jose Maria College of Medicine Foundation. We are now ready to serve you.
Good afternoon to everyone. So I guess we are starting this afternoon. So ayan, magandang hapon po sa lahat, to the viewers, to our students, the faculty, the other stakeholders of Jose Maria College and Jose Maria College of Medicine Foundation. Welcome to another series of JMC EduTrends. And today's topic, we will be having an update on the COVID-19 updates, current situation, management, and the search for the vaccine. So, I'll be flashing our screen for the program flow for today's discussion. Okay, so hello, can you please flash the screen for the program? Yeah, okay. So, again, I will be giving the overview of the topic, and I will be introducing the speakers. I'm Dr. Raymond G, Libongcogon, your moderator for this afternoon's discussion. Our discussion is divided into several parts. For the first part, the current situation in the global, national, and the local sectors with Dr. Rhea Lanaban, our resource speaker. The second part is the workplace health and safety precautions with Dr. Aileen Polinar, and the third part, the COVID-19 mix and current issues with Dr. Therese Alba, and part 4, updates on the management and the search for the vaccine Dr. Rhea Lanaban, our resource speaker. However, our resource speaker will also be contributing reviews and thoughts on different topics for today. So the last part will be the Q&A from the audience and the collated questions we have right now. Okay, let's proceed. I will be introducing our speaker for today. So first, we have Dr. Aura Rhea Lanaban. She is the current chair of the Department of Clinical Sciences in Jose Maria College of Medicine. She is also a diplomate in family medicine, a fellow of the Philippine Academy of Family Physicians, and fellow of the Philippine Society of Hospice and Palliative Medicine. Currently, she is also serving as a consultant in Southern Philippines Medical Center here in Davao City. Our uh, Another speaker is Dr. Aileen Polinar. She is the current chair of the Department of the Basic Sciences here in Jose Maria College of Medicine. She is a master's degree. She has a master's degree in management in health administration and lifestyle medicine, and a diplomate of the Philippine College of Occupational Medicine. And our speaker again, our third speaker is Dr. Nancy Therese Alba. She is serving as the section head of the Family and Community Medicine of Jose Maria College, and she is also a diplomate in family medicine. Okay, let's clap our hands and let us welcome our resource speakers for today's discussion.
Hello,
Okay.
everyone.
Hello po, Dr.
Good
Aura.
Okay, I'll try to share my screen, ha? Can you see it? Plano na yung screen.
Yeah, we'll be waiting for
yung slide. Nakikita na po yung slide ko, Doc Raymond.
Yeah. Yes, Doc.
Okay.
Nakikita na siya. Medyo may delay lang sa broadcast, but it's already here.
Sige. Okay, good afternoon, everyone. And again, good afternoon to my co-panelists. So for this afternoon, we will be talking about COVID-19. So you could see here sa first slide ko ay borrowed from the page and new natin na trust on how to prevent COVID. Ito yung bago nating modality. So yung bida solution sa COVID-19. I hope that you've seen yung mga posters na nakalagay sa labas or even in the television, they are being flashed to remind us how to be part of the BIDA solution, okay? By wearing our mask, sanitizing our hands, making sure that we are at least 1 meter apart, or we maintain social distancing, and of course, validating, okay, the information that we get either from the social media, okay, from the talks with our friends, family members. We all know that this pandemic has brought a lot of issues in our society, okay? So where are we now? Okay, for the past 9 months since the COVID-19 entered the Philippines, so it was last March, okay, March 2020, okay, when we had our first na case ng COVID-19. Okay, so there has been changes in our lifestyle. There were already, we've been through ECQ, GCQ, MGCQ, and now we are back to GCQ, okay? Some of our students, if you could see here in the slides, diba, yung ating mode of transportation, there are modalities being implemented so that it will lessen the transmission of the infection. For the students, this is quite a challenge because the mode of teaching and learning has really shifted, no, to online, okay? And then of course, our usual practices and our usual daily routine has already been changed because of this pandemic. Okay, so now we are nearing the end of 2020 and we are already thinking, ano na tayo ngayon? Saan na ba tayo ngayon from the time that this pandemic has started? Okay, so for the information of everyone, okay, as of November 24, 2020, ito yung latest kasi sa WHO, okay, we are already 58 million 900,547. Okay, meron na tayong almost 59 million rather na COVID-19 confirmed cases in the whole world. Okay, and that includes almost 1.4 million deaths because of the COVID-19 infection. Okay, if you look at this in a global perspective, no, versus the number of population worldwide, this is still a very significant, okay, dent in the population. Okay, so there are some news, di ba? If you look into the social media, questioning the real existence of the virus. But if you could see here, okay, in the bigger picture, this is a real, public health issue. And if you look at this diagram or this graph here, okay, there is the breakdown out of more or less 59 million. Southeast Asia, where the Philippines belongs to, okay, meron na po tayong 10 million, okay, 10.5 million rather sa ating area. Still, ang nangunguna pa din is the Americas, okay, that includes the USA, okay, and then North and South America or Latin Americas. Okay? And then followed by Europe. Medyo mas nauna lang po yung spike ng Europe, okay, versus the US or the Americas. But again, mataas pa din ang kanilang numbers of confirmed cases. Now, what about the Philippines? Okay? Kasi sometimes if you talk about the world perspective, hindi natin masyadong na-feel kasi malayo naman tayo or sometimes hindi siya real for us because we haven't experienced it ourselves. Okay? So sa nationwide po, based on the Department of Health, nationwide census po natin, we are already 421,722 cases as of November 24. Okay, that is at present, okay, not present rather, yung sa kanilang nakatali po, there were 26,745 active cases and we have already 386,000, okay, 792 na recovered confirmed cases. Unfortunately, okay, more than 8,000 po na po yung ating mortality rate or people who died because of the said infection. So makikita po natin sa diagram or sa graph below, yung trend natin, di ba? We are trying to flatten the curve. Okay? Nung March, medyo mababa pa tayo up until June. And then it escalated by July. Okay? And then now, at present po, we are still having a lot of cases. I will show yung ating local data, okay? But again, these are cases that were recorded and tested. But again, we don't know because most pa din ng ating mga cases, I will show you a diagram later, are asymptomatic. And that is really a very important aspect in this pandemic that we have to understand. So, ito na yung mga distribution ng ating mga cases. Okay, ito pa din yung top region, NCR. They are already pushing 200,000 cases. Okay, followed by Calabarzon area, Central Luzon, Central Visayas, and Western Visayas. Okay, and then we have also the top provinces or city. Okay, yung nag-follow na ng nangunguna sa city is your QC, Quezon City, garnering a total of 35,729 cases. So if you could see here, okay, spread out yung ating mga top regions. But look at the right lower portion, yung new cases in the last 14 days. Okay? Second na yung Davao. But again, there were days kasi na umaabot talaga ang Davao ng top 1. Competitive ang Davao City. That is the reason why, because there has been a surge in our city, that the IATF has to look into how we manage our cases here. Okay? So ito pa din, if you look at the census for the last 14 days, okay, Davao region has already been, okay, a part of the top 5 areas or regions. So ito po yung ating sinasabi na we are testing. Okay? Nagtitest naman po tayo ng ating population, and as of the start, from the start po ng ating testing, we have already tested 5,554,475, more or less, no, 5.5 million, so pushing for 6 million. Okay? And our cumulative positivity rate, meaning po sa lahat po ng tinitest natin, okay, if 5 million is 100%, 9.1 po yun, okay, are yielding positive results. This is out of the 160 laboratories that we have in the Philippines. Okay? But not all laboratories are able to submit po yung kanilang result. That's why ang DOH caveat po is that hindi natin pwedeng sabihin na ito lang yung cases or ito lang yung labs, because there are some delays with the recording and reporting of the cases. Okay. So ito po yung mga facilities natin. Okay. So this is just an overview kung how ready is our country in dealing with COVID-19 patients. Okay. So in the whole Philippines, we have a total of 1,264 facilities, that is including our very own Southern Philippines Medical Center. Okay? So versus yung ating hundreds of thousands of cases, di ba? Limited lang talaga yung ating facility. Although this, if you could see, the bed occupancy rate is only 37%, or a total of 22,020 na mga cases who are admitted. But remember, these are yung mga facilities na supposedly able to cater. But in reality, these are not all translated to the capacity of the hospital to manage cases. Bakit po? Even if you have a 500-bed capacity, for example, no, in a hospital with a 500-bed capacity and a 20-bed capacity ICU, for example, in that case, and you don't have nurses, then you cannot fully function as a 500-bed capacity. Most of the time, in the real world, in our real setting here in the Philippines, ang 500-bed capacity na hospital at present will not be able to cater 500 patients. Okay, because number one, lack of nurses or manpower. Second, that is pre-COVID era na bed capacity. Now we have COVID, you have to strategize and you have to do engineering works to make sure that you are able to accommodate and make sure that there is really a good setup, that there is no way that the COVID-19 can spread between wards or between rooms. Okay, so nako-convert yung mga hospital na supposedly nakaka-cater ng madaming beds. They are forced to cut the capacity into half, and more so because there is lack of manpower, mas maliliit yung or lumiliit yung kanilang capacity to accommodate patients. Okay. So how about in Davao City? Let's focus here sa ating region. Okay? So we have, okay, ito yung kanilang the last data that was published by our CHD. We have a total of active cases na 2,530. But if you take into consideration the cumulative na, okay, we have a total of 8,428 cases, and we have 5,579 recovered. Okay. Unfortunately, we also have 319 patients who died because of COVID-19. So if you look below the breakdown of our active cases. Okay, so yung mga out of the 2,590, yung ating active cases ngayon, 51% are asymptomatic. Meaning they are patients probably na contact trace ng DOH, or these patients have just gone or undergone a routine swabbing, probably a requirement of their institution, but they yielded positive. So titingnan natin sa ating mga patients, okay, 49% lang yung nagre-present ng symptoms ranging from mild, okay, severe, or critical. But 51 are asymptomatic. If you can just imagine, if these 51% did not subject themselves to swabbing because they don't have any symptoms, hindi tayo aabot sa mataas na bilang. But again, on the flip side, that tells us that everyone, okay, yung pwedeng makasalubong mo, or even your household member, could be a carrier. So that's why the best, they say, way to prevent infection, okay, infecting yourself or infecting other people, is to assume that you yourself is also or could also be a carrier of the virus. Okay? So ito yung breakdown. So 44% are mild cases. So usually in our region, that is one of the mandate now. All positive cases has to be or must be admitted. They are not, because of the surge that we have in Davao City, home quarantine is no longer an option. If you are positive, unless you are already tagged as recovered, you should be admitted either in SPMC. We have already private hospitals that caters COVID confirmed cases, and you could also be admitted, okay, if you are asymptomatic or doesn't really need tertiary hospitalization, then you have to be quarantined in a temporary facility, okay, like in Malagos, in Mamayin. We have several. I think we have in Davao City mga 8 to 10 temporary na facilities, okay, that asymptomatic confirmed COVID-19 patients can be quarantined. Okay, so out of his, if you could see, 0.4 are patients who are critical. Okay, these are patients needing ventilatory support, yung ventilator, okay, or patients who have progressive pneumonia, pangit yung X-ray or ang CT scan, or very risk for suffering respiratory arrest. So eto naman po yung another, okay, na presentation natin on the testing. Okay, so again, if you could see here po sa ating weekly testing statistics, ito po yung nakalagay natin sa Davao City po. We have, or rather Davao region, so we have four po na testing sites. We have SPMC, yung molecular laboratory natin. We have the RMC, Davao One World Diagnostic Center, and we also have Davao Doctors Hospital. Titingnan po natin yung yield or yung mga number of samples being tested po. Number one pa din po is SPMC. So most of our samples being collected, meron po tayong mga sites sa Santa Ana, okay, yung main health center. They are doing the swabbing, but the processing is being done in Southern Philippines Medical Center. Okay, so cumulative statistics po, ganun pa din. If you could see, SPMC still is doing more or a lot of testing, kaya mataas din yung ating positivity rates. Okay, and more so, mataas yung positivity rate, if you could see here in the cumulative testing statistics, is because most of the patient being referred to SPMC are already yung mga suspects, meaning these are patients who have symptoms. Hence, when you test them, more or less you would have a positive result versus yung mga like in One World, although mataas pa din, medyo mababa yung kanilang positivity rate because some are asymptomatic. Okay, nagpapatest because requirement probably, or they were conscious because, or just want to make sure that they really don't have the virus, because again, in One World you have to do provide out of pocket na expense unless it is being shouldered by the government. Okay, so wait, Okay. So punta naman tayo sa SPMC. So our very own na government hospital. Okay? So as of November 23, ito po yung kanilang tawag nito, census. Okay? So they had a 25 new positive. So that puts a total of 4,327, okay, na total cases natin na dumaan sa SPMC. And as of that day, November 23, they are catering 319 active na COVID-19 infections. Okay? So out of that, okay, out of 4,327, 3,677 rather have already been they were already tagged as confirmed COVID-19 recovered case. Okay, unfortunately for that day as well, okay, they had 6 deaths, so that puts it a total of 252, okay, na total deaths na natali ng SPMC sa kanilang own na institution. Okay, so for the testing naman, okay, so we have, if you could see here, no November 23, okay, meron tayong 201 individuals being tested. Medyo maliit siya, okay, contrary to the usual, no? But again, the testing kasi natin in SPMC is subject to the availability of the kits. So these kits are still going to be course through the national government, and they have to be endorsed to the institution. So FYI lang po, medyo limited yung mga kits ngayon, but we are still waiting, no, na madagdagan so that we can continue testing more patients. Okay. So if you could look here in the ICU beds, di ba, we have an ICU complex in SPMC. Okay? So we can cater actually a lot of patients sana in the ICU. But remember, aside from the COVID patients, so if you can see, if you could imagine here, if you have a total of 390 active cases at SPMC, these are only COVID patients. But you have to remember, SPMC is also catering non-COVID cases. Okay, so you have patients coming in because of MI, coming because of complicated diabetes, patients who are on dialysis, patients who have cancer, okay, patients who had gunshot wound, appendicitis. So this is on top of the usual, okay, non-COVID cases. So for the ICU beds, no, allotted for COVID-19, okay, 28 out of 30 is already occupied. So that is already beyond the critical level of the capacity for the critically ill COVID-19 patients. Okay, and then we also have 80% na again beyond the critical kwan na namin na parang parameter on, ward beds, okay, allotted for COVID-19. Okay? So, eto naman po, we have been talking about the public, kung gaano kadami na po yung mga pasyente contracting COVID-19, how many has recovered, how many has died. But again, let's look at the healthcare workforce. Okay? Kasi tao din tayo eh. Yung mga doktor, mga nurses, mga cooks, okay, nursing aid, hospital personnel, they are also subjected. Okay? More so, they are catering COVID-19 patients, mas at risk din sila in contracting the diseases. So, as of November 23, okay, there is already a total of 1,252 healthcare worker who have been who have been infected by the COVID-19 virus. So, there are 420, okay, na healthcare workers, okay, who sa Davao mind you, this is Davao region. We have 420 admitted healthcare workers, Okay, presently admitted ito. So remember, if they are admitted, meaning they are not able to work, and you have 420, no, mga healthcare worker who are not able to perform their tasks, and therefore limiting the manpower to cater to another or to other COVID-19 patients. We have 6, unfortunately, who succumbed to the infection, and we have 826 already recovered. Some are still undergoing their quarantine, okay, after the discharge from the facility. Okay. So I think that ends my first part. I will show na lang later, Doc Raymond, yung ating vaccine, or is it okay that idiretso ko na lang? Or I'll just wait na lang on the fourth or the last part.
Yeah, so Doc, I think it's better if you will reserve that for the last part. So Doc, thank you for that, for that overview. And we know that there is still the threat of COVID-19 is still present. We must have constant vigilance and constant adherence to the precautionary measures. The public, we are currently, based on the figures, there is a trend that the trend is still present, and even the healthcare workers are being affected, so pag bumaba yung dami ng available healthcare healthcare workforce, mas difficult ang magiging treatment natin. So it's up to each of us to mitigate, to help decrease the transmission by observing the precautionary measures constantly. So before we proceed to the next part of our discussion for today, there will be a short break. And I would like to also inform everyone, our viewers, more than 100 na daw tayo na viewers right now, both in YouTube and Facebook. So marami tayo na reach with this webinar. So to the viewers, you can send your comment. You can send your questions by commenting on the YouTube, on our YouTube and Facebook. So, Ma'am Mirna, we will be having a short break before we proceed to the next.
Take a breath and look around. Did you ever want with unity. No matter what pain, no matter what strife, we can make it through with God on our side. Let's fight the suns and me. Let's be one, you and me with unity. No matter what pain, no matter what strife, we can make it through with God on our side. Look what things can get better. To break beliefs we can conquer. Distance and difference don't hinder. Fear not, we're all in this together. Look what things can get better. To break beliefs we can conquer. Fear not, we're all in this together.
Okay, thank you for that. It was an original composition of the Jose Maria College of Students. Let's fight this unseen enemy. Okay, let's go to our second part. I would like to invite our next speaker, Dr. Aileen Polinar. She is the current chair of the Department of Basic Sciences here in Jose Maria College of Medicine, and also a diplomate of the Philippine College of Occupational Medicine. And she will be talking about the current safety precautions for the workplace. So, without further ado, I would like to welcome Dr. Aileen Polinar.
Hi, good afternoon, everyone. First of all, I'd like to commend the effort of the JMC Office for Communications, together with Dean Dr. Dahlia Arancel, our College Secretary Dr. Raymond Libongcogon, and my co-speakers Drs. Alba and Lanaban, for this very timely information dissemination. So, the workplace plays a vital role in the prevention of COVID-19 and the promotion of health, because we spend about 4 to 8 hours of our daily lives at work. So, a vital step to achieving these is the identification and classification of the workers' exposure risk to COVID-19. The first of the 4 categories is low exposure risk. So these individuals are only in contact for a brief period of time, less than or equal to 2 minutes, jobs that do not require contact with people known to be or suspected of being infected, workers that have minimal occupational contact with the public and other co-workers. Here, physical distancing is being practiced at all times. Medium exposure risk individuals are in contact for a longer period of time and are fairly distant from each other. The jobs that require frequent or close contact with people who may be infected but who are not known or suspected patients or close contacts of the same. Workers may have contact with the general public, especially when they spend time dining in restaurants, in high population density work environments, and in some high volume retail settings, including individuals returning from locations with widespread COVID-19 transmission. Here, there is still a practice of physical distancing at all times. For high exposure risk, individuals are in prolonged close contact more than 15 minutes and may not be able to practice physical distancing at all times. Large group of individuals in a given time, such as the inmates in prison. Jobs with a high potential for exposure to known or suspected sources of COVID-19, the healthcare delivery, healthcare support, the medical transport, and mortuary workers exposed to known or suspected COVID-19 patients, or bodies of people known to have or suspected of having COVID-19 at the time of death. These belong to the high exposure risk. For the very high exposure risk are healthcare workers, morgue workers performing aerosol generating procedures on or collecting, handling specimens from potentially infectious patients, or bodies of people known to have or suspected of having COVID-19 at the time of death. So, as an occupational physician, I am familiar and we employ, I employ different sets of controls in an institution or a company. So the most effective of all is the engineering control, and this is followed by the administrative control, and the least effective is the use of the personal protective equipment. So as for the engineering control, it requires a physical change to the workplace. Such is installation of physical barriers, the acrylic barriers that we use, or as you see in stores, the thick plastic covers, they use them as barriers, sneeze guards, HEPA filters in more sophisticated institutions, ventilation, and etc. For the administrative control, we change the way people work. So, institutions or companies make protocols, policies on physical distancing, hand washing. And for the PPE, this one requires the worker to wear something. So, this depends on the worker's risk based on the Health and Safety Committee recommendation. The engineering controls isolate workers from work-related hazards. So the goal is to reduce the exposure of these workers to hazards, okay, without relying on worker behavior, and it is the most cost-effective solution to implement. So engineering controls for SARS-CoV-2 includes installing high-efficiency particulate air filter, the HEPA filter, increasing ventilation rates in the work environment, opening the windows, installing physical barriers such as clear plastic sneeze guards, specialized negative pressure ventilation in some settings such as for aerosol generating procedure, installing permanent walled or temporary screened isolation rooms for suspect cases in the work sites because it is mandatory for all work sites to have an isolation area different from the clinic. So installing additional hand washing or disinfecting facility or equipment in the work site. Administrative control would aim to identify vulnerable workers based on occupational health data. This encourage sick workers to stay at home. Isolation area, which I've said earlier, not the clinic, should be preferably have good ventilation. Air condition is not encouraged. Minimize contact among workers, clients, and customers by replacing face-to-face meetings with virtual communications and implementing telework if visible. So it's being applied right now in most institutions, and even at JMC, we employ the online school, no? Online teaching, and in clinics, doctors employ the teleconsult. Then we should establish alternating days or extra shifts that would reduce the total number of employees in a facility at a given time, allowing them to maintain distance from one another while maintaining a full on-site work week, discontinue non-essential travel to locations with ongoing COVID-19 outbreaks, develop emergency communication plan, including a forum for answering workers' concerns and internet-based communications whenever feasible. And workers must be provided with up-to-date education and training on COVID-19 risk factors and protective behaviors such as cough etiquette and the care of the personal protective equipment. So the workers are they are educated by telling them that whenever they cough, they should not be using their hands to cover their mouth. You can use the part of your arm, okay? And for the personal protective equipment, some lay people, they try to douse it with alcohol, no? But without knowing that the alcohol can destroy the very material that can protect us, and then they reuse the surgical mask. So our workers must be taught on how to take care of the personal protective equipment. Workers must also be trained, okay, to use protecting clothing and equipment, the donning and the doffing, correct donning and correct doffing of this protective equipment. The site-specific preventive materials must be in place and with the adequate supply. Sanitation, disinfection, and disposal measures and protocols are very, very important. Physical distancing protocols and health screening protocol with health screening daily. Self-quarantine and return to work protocol. But again, as Dr. Lanaban has mentioned, we do not encourage home quarantine anymore with positive patients, so they must be admitted. Labor relations alignment and education on the pandemic response plan for their cooperation, communication and employee training and education, facility signages. It's very important that you place signages to remind our workers to wash their hands, to establish adequate social distancing, and as much as possible, these signages in English, it can also help if we translate this into our own dialect, the local dialect, the Bisaya or Tagalog, so that everyone in the facility will understand this reminder. Virtual meetings, site visits, and training through the use of web conferencing applications or video calls. So work from home is being encouraged. Alternative workplace accommodation. The institution can provide a temporary accommodation, especially for workers from far-flung areas and working hour shifts. Hotline can be established, a call center, the telemedicine services, and on-site or near-site accommodation and transport or shuttle services. So we can see these shuttle services among call center groups or institutions. So the personal protective equipment, the least effective, but because this is also affected by the behavior of the one using it. So this refers to protective garments or equipment worn by individuals to increase personal safety from infectious agents. So the PPE protects the user against health or safety risks at work. It can include items such as safety helmets, gloves, eye protection, high visibility clothing, the safety footwear and safety harnesses, and includes respiratory protective equipment such as the face mask. And also included here are the face shields. So for very low risk workers, workers at the admitting area, accounting, billing, field health, records, social service, human resources, pharmacy, office personnel with minimal or no direct contact with patients, driver not transporting patient, minimum requirement is a face shield or goggles and a surgical mask. So for the low risk, the security guard, the security group, cashier, food servers, utility workers, in maintenance, housekeeping, helpers, not assigned to patient care or handling body fluids, minimum requirements would be face shield or goggles, surgical mask, and a pair of gloves. For medium risk, these are direct patient people in direct patient care in non-COVID zones, assigned people who are assigned to high-risk zones, dirty ICU but not directly handling patients, utility workers handling bodily fluids, and private transporting patient. Minimum requirement would be an OR cap, face shield or goggles, a surgical mask, an apron, and gloves. For high-risk individuals, these are individuals in direct care of patients in high-risk zones, the doctors and nurses, the nurse attendants, utility, the triage team, the medtech, radtech, and those performing aerosolizing procedures such as intubation, suctioning, nebulization. Minimum requirement would be OR cap or hood, face shield or goggles, N95 mask, a gown or coveralls, double gloving, and booties. So how to wear a medical mask safely? So these are the do's. No, we have do's and don'ts of wearing masks. So this has been presented several times to us, but still we commit the same mistake over and over again. Okay. So first, we should learn to wash our hands before touching the mask. You inspect the mask for tears or holes. Find the top side where the metal piece or stiff edge is, and ensure the colored side faces outwards. Place the metal piece or stiff edge over your nose. Cover your mouth, nose, and chin. Adjust the mask to your face without leaving gaps on the sides. Avoid touching the mask. Remove the mask from behind the head and keep the mask away from you. Discard the mask after use and wash your hands again after discarding the mask. Don'ts: please do not use ripped or damp mask. Please do not wash your mask with cleaning solutions, especially the surgical mask. Do not wear the mask only over the mouth or nose. Do not wear them loose. Do not touch the front of the mask and do not remove the mask to talk to someone. The mask is for your protection. So when you talk to someone, it must be used at all times, covering the nose, the mouth, and the mouth. So do not reuse the mask. Remember that masks alone cannot protect you from COVID-19. So another important factor is the uh, use of a 1 meter distance protocol, 1 to 2 meters, and washing of hands frequently. So who belong to the vulnerable workforce? Those who are at high risk pregnancy, 60 years old and above, any age with comorbidities or pre-existing illness such as uncontrolled hypertension, uncontrolled diabetes, recurrent asthma attacks, COPD, cancer, blood dyscrasias, chronic liver and kidney disease, or with immunocompromised status. Employers are highly encouraged to allow work from home and provide alternative workplace accommodation or work on our shifts. So this is the triad: the host, the agent, and the environment. So workplace preparedness. You should think about how you can organize your work area so that you can keep people at least 1 to 2 meters apart where possible. So we have to physically arrange our work areas to keep people at 1 to 2 meters apart. If ever you cannot keep a 2 meter physical distance, you can employ marking areas or floor paint or tape to help people keep a 1 to 2 meter distance so that it will remind them that these areas are the areas where they should be situated at. Provide signage to remind people to keep a 1 to 2 meter distance and avoid working face to face or side by side. Assign one person per work area and reduce the number of people in that work area. So that is why we should work on shifts so that not all employees are cramped up in a tiny space. Assigning and keeping people to shift teams that I've mentioned, and keeping the number of people working less than 2 meters apart to a minimum. Using screens to create a physical barrier between people. So this shows the barrier being used in companies, and you can see the tape marks on the floor which serve as guide. Here, only one worker is allowed per workstation. So that is about 1 to 2 meters in distance. And the signage reminding the workers in the workplace. So you need to think about how to keep the work area clean and prevent transmission. Very important is the hygiene and sanitation. You should consider disinfecting frequently, touch surfaces and the tables, the doorknobs, light switches, the phones, toilets, among others, should be cleaned at least every 2 hours. Okay, so that would also include credit card terminals, shopping cart handles, car door handles, and trash cans. Moving around, you need to think about how people travel through work environments. So permit only essential trips within buildings. So as much as possible, do not allow people working on computers to cross boundaries and go to people working on files, okay, or books. So just to maintain social distancing, restrict the amount that people rotate between jobs and equipment. So here is a tiny space of elevator space but still there is a need to establish distancing. So here are the marks to remind the clients and the employees that they should follow physical distancing. And this one is being employed in banks and other government institutions serving us. So in common areas, physically moving tables and chairs, so they are 1 to 2 meters apart. So what we should do is we should stagger break time. So not all people should have the same break time. So if going out for lunch, we could start the lunch time at 10:30, one batch, 11 o'clock, 11:30, 12, and 12:30. So this is being employed in one of these companies I handle. So where this is not possible, creating additional space for people to take their breaks in. No? If it's not feasible to have a different break time, so we create more space. And then again, we mark areas using floor paint and tape. And we can the use of outside facilities during breaks is as much as possible encouraged, but if it's safe to do so. So encourage workers also to stay on site during working hours. So this is an example of a cafeteria. So they're still in front of each other but with barriers. So the least possible contact employed. Here with a round table, just a standard round table with the use of acrylic bars across each other. So you can make use of 4 spaces for 4 people only. So good hygiene, which is very, very important. So it's not just the use of the PPE, not just the social distancing, but the good hygiene. So provision of hand sanitizer in addition washing facilities is very important. And then again, using signs and posters to increase awareness of good hand washing technique and provide regular reminders on avoiding touching your face and to cough and sneeze into your arm, touching your eyes. Provide hand sanitizer in all locations and different areas. That is in addition to the washrooms. And there should be clear guidance for the cleaning of toilets, the showers, and changing facilities to make sure they are kept clean. So when we clean the workplace before reopening, especially if the place has been closed for a while or partially operating, we have to make an assessment of all sites, all parts that have been closed before restarting work. We should be cleaning them efficiently, thoroughly before starting work. And if the area is enclosed, air conditioned, we must provide for windows to create a good ventilation. Otherwise, you have to make space, another working space or working area where there is good ventilation. Shift patterns and working groups, as I've said, we can create shift schedules of employees. This is used by health workers in hospitals, especially the nurses, the doctors, and in BPOs. So as far as possible, where people are split into teams or shift groups, fixing these teams or shift groups so that that where in contact is unavoidable, this happens between the same people. So as much as possible, we create a cohort. Those people on the same team, on the same schedule, should be together on a daily basis, depending on their schedule and on their work. So they should be together. So that's what we mean by creating a cohort of these workers. For those who make delivery services, okay? So putting in place procedures to minimize person-to-person contact during deliveries is very vital. Like for example, when we order from Food Panda, there is a section there which you can choose if you want the rider to just leave the food on a designated drop-in area, or would you want to pay cashless, so using your electronic card such as your ATM or your credit card. So this is another very good tool that we can employ, especially in this time of COVID. So prior to going back to work, The barrier should be set already. Engineering controls, ventilation must be installed, negative pressure ventilation whenever possible, and then adopt new corporate framework, identification of vulnerable workers based on occupational health services data, so on and so forth. These were mentioned earlier. So the attire, encourage wearing of shorter sleeves for ease of hand washing, except in jobs that need long sleeve protection. Example, the chemical handling, construction. Avoid neckties, wearing of jewelries and accessories. Excuse me. Encourage females to wear pants instead of skirts. Wear closed, comfortable shoes with socks, safety shoes and boots, and do not repeat used clothing. Please, these clothing must be washed thoroughly and disinfected. So at the workplace, queuing must be 1 meter radius from the front, side, and back. Floor markers in place. Hand washing stations must be present. No mask, no entry policy must be implemented. Now, if upon entry of these workers, there is a temperature check. So what we follow, if the temperature is less than 37.5 degrees, then the worker may enter the workplace. He should disinfect by soaking shoes, footwear and doormat with disinfectant, hand disinfection, and mandatory use of face mask. Now, for the health checklist, if there is a yes answer on any of the checklist like sore throat, body pain, headache, cough, colds, fever in the past few days, close contact with confirmed COVID-19 patient, contact with anyone with above symptoms in the past 2 weeks, travel outside the Philippines, travel to any area in NCR and other regions confirmed to have COVID-19 cases, we put them in the isolation area. Remember, the isolation area is not the clinic. So a health personnel using the proper PPE would assess them further. If needed, they may call the DOH hotline, the municipal health office, or the city health office and the BERT. Now, if none of the above is present, the answer is no, then the worker may enter the place. Personal pens must be used. And if ever you don't have your own personal pen, always make use of sanitizer before using the pen and then sanitize it after. Now, if there is a need for sending the patient home, send them home. As per medical advice from the management, we may refer them to the MHO or the CHO and may use company vehicle if warranted with precaution of proper use of PPE. Now, if the temperature is more than or equal to 37.5 degrees centigrade, the patient or the worker must be isolated and temperature recheck must be done after 5 minutes. If still with fever, then the health personnel will again reassess and may consider sent home or refer to the CHO, MHO. Biometrics, automated machines, clean hands before and after using these scanners. Also, clean the photocopy machines, shredders, ATMs. So these are the behaviors that must be behaviors and practices that must be used inside the workplace and during the break time. All of these geared to physical distancing, okay, the use of the PPE, okay, and sanitation and hygiene. So upon going home, dispose the mask used, place them in a separate plastic and dispose in designated infectious bins. After use of washable masks, they must be kept in a closed plastic bag. Refrain from putting in your pocket or inside your personal belongings. Refrain from kissing or hugging family members. Take a bath first. Discard in separate hamper used uniform or outfit away from family members or immediately soak in water with this detergent and disinfectant. Essentials brought home like ID tags, bags, keys, etc. should be securely placed outside the house and frequently cleaned Clean the cell phones and gadgets you use. Put in Ziploc plastic for easy cleaning or change every after tour of duty. Follow physical distancing in vehicles or in any form of transportation. So with all these, it creates a an emotion. There's an emotional trauma to this pandemic. Not just emotional, but mental. There's a physical. It's like being alienated physically because of the social distancing. So there is a need to increase our physical and mental resilience. So first, we should ensure access to basic needs of individuals. That would include food, basic necessity, food, water, shelter, sanitation, clothing, support adequate nutrition and diets based on risk, encourage appropriate physical activity for those with access to open spaces as long as physical distancing is practiced. Fitness programs are also being established in companies. So the company may still continue with the fitness programs provided that there is ample space and that space is an open space, so they can still continue with the fitness program because this fitness program is also a stress reliever. So discourage smoking and drinking of alcoholic beverages, protect the mental health and general welfare of individuals. Okay, provide support online. You talk to friends online. Encourage them to talk to the management or to the peers. Promote basic respiratory hygiene and cough etiquette. Protect essential workforce through provision of food, PPE, and other commodities, lodging, and shuttle services as necessary. It is the obligation of the employer to provide the personal protective equipment. Provide financial and healthcare support for workforce who contracted COVID-19 through transmission at work. Limit exposure of most at-risk population groups, such as through limitation in entry or prioritization in service or provision of support. Whenever possible and feasible, employ different entrance and exit points in the company or in the workplace. Provide appropriate social safety net support to vulnerable workforce for the duration of the COVID-19 health event. That's all. Thank you.
Okay. Thank you very much, Dr. Aileen Polinar, for that very comprehensive and very timely discussion on workplace safety policy for COVID-19. Alam naman natin na ongoing, marami ang tuloy-tuloy ang pagpasok ng mga employees in their respective companies or establishments, and we must ensure that while we're doing work, while doing our work or our jobs, we must employ these policies. We are encouraging the employers, the companies, the different establishments to ensure that there is a policy in place to protect our workforce. So maganda yung medyo maganda yung nabanggit ni Doc, especially yung yung isa sa mga way to minimize transmission is even using your own ball pens in writing or in accomplishing forms, di ba? Because mahilig kasi tayo sa hiram-hiram ng ball pen. So ito pala magiging source of transmission. So simple lang na And also, please take note that everyone is encouraged to look for ways to increase our mental and physical resilience. So let's take a short break muna before we proceed to the third speaker for today. So again,
I thought that the school doesn't accept Muslim students and that if you enroll in JMC, you will be forced to join the kingdom. But I was wrong.
This institution is a non-sectarian school. The people here are very approachable, and I don't feel any barriers between and among us. When I became a beneficiary of the Gift of Education program of the JMC founding president, Pastor Apollo C. Kibuloy, I feel so blessed and thankful to God that I enrolled in this institution, which is very excellent, and to have instructors who are also excellent. World-class facilities that help me access better learning. In this Gift of Education scholarship, we are given the chance to avail 100% free tuition.
And I was glad on the benefits of the scholarship, seeing that if you are valedictorian, you will have a benefit of free tuition and you will have to pay only half of the miscellaneous.
Well, here in Jose Maria College, they made it easy for you. You only have to focus on your studies. This encouraged me more to study harder to maintain the scholarship.
Today, I no longer see myself as a mere student.
From it, I was so very thankful
For granting me this gift of education, to the man behind JMC,
of our founding president, Pastor Apollo C. Kibuloy,
for giving me this
opportunity.
this gift of education.
I decided to enroll my son to Jose Maria College because Jose Maria College has a reputation for maintaining a very high standard of discipline, and also I have heard that the academic staff is qualified and maintaining high standard of education. More concerned about others and also willing to give a hand to poor and help the others. So he changed in a good way in every aspect.
My children do not feel they are out of place because it's a non-sectarian school, so everyone is welcome at the Jose Maria College.
Okay, we are back. So for our third part of the discussion, guys, dahil nga sa ano, we know that because of the easy access to internet, to social media, grabe yung explosion ng information, especially since this pandemic has started. And there are a lot of reports of fake news, fake news information, false information. And with that, we must we must also know how to filter out what are the facts or what are the myths. So to tackle those COVID-19 myths is Dr. Nancy Alba. And Doc, I'll be giving the floor to you for a discussion of that.
Okay, thank you, Mon. Okay, screen.
So again, guys, sa mga to those who are with us, please, if you have questions, just place those in your comment section. So I would like to greet our viewers, especially our dean, Dr. Dahlia Arancel. She is watching right now, and many of our faculty and medical students.
Okay, I think my screen is hanging, so I'll just wait.
So, yun nga. Recap lang, we have already talked about the current situation in the global, national, and the local sector. So, we also talk about the office, the policies and safety precautions in workplace. Now we will be discussing the COVID-19 myths. So, marami yan sila. Yeah.
Okay. So, good evening again to all our participants. This is actually the WHO website termed this as mythbusters because of the lots of rumor going around regarding some of the opinions of some people and even doctors at that. So the slides that I will be showing you are just actually from the website of World Health Organization. So the answers here are really validated by World Health Organization. Okay, so the first myth that I would like to present here is the myth about the tubog. Remember, during the early days of COVID, especially in Cebu, it was actually an issue whether it was effective or if it's not effective. And it's really hard if one of those people in authority would say that this is effective, so people will follow. But in actuality, in reality, no studies even documented the effectivity of doing COVID. Doing the steam inhalation, the tuob, or the saline cleansing of your nose. So the studies would show that there is no evidence pointing out that it will protect anybody or it will protect a patient with COVID from progressing with the infection or preventing the infection. But the study would show some limited evidence, they say, would show that this will help in the early recovery from common colds, but never to prevent the having infection from COVID-19. So this is one of the common myths that we had in the early days of COVID. Okay, so it's not true. It will not protect us, and it will not prevent infection from acquiring the COVID infection. Okay, second, okay, ito I think it's common also with us, yung garlic daw. So you eat garlic so that you will not get COVID. So it's a myth. Eating garlic will not protect you from acquiring COVID infection. Even if a study would show that garlic would contain some of the antioxidants, which is good for health, but with that, it cannot protect you from acquiring COVID infection. Okay, so that's the second. So third, okay, ito, ano daw, adding pepper to your soup or any yung chili powder would prevent you from getting infected by the COVID virus. So hot peppers in your food could be very tasty, can make you sweat, but it will not protect you from acquiring COVID infection. So the documented things that will protect you would be balanced diet, getting hydrated, enough water for the day, and doing regular exercise and sleeping well. So yun ang documented, but not adding pepper, eating garlic. Those things would not protect you from acquiring COVID infection. Okay. Next is ito, yung alcohol. Sabi nila kasi, di ba, those who are engaging in alcoholic drinking session would say that it will protect them from acquiring COVID infection. That's why sabi nga nila mas hindi sila tinatalaban because may alcohol daw yung kanilang drinks. But
because they are associating this alcohol as our disinfectant with drinking alcohol. So kaya it was labeled to be protecting them from COVID-19, but it's not true. There was no study, not even one study would say that drinking alcohol will protect you from having COVID-19. It's even dangerous for your health, for your liver at that. Next is ito. I think you have heard this also. Now, you put your hands on the hand dryers so that it will be disinfected. So it's not true. The hand dryers will not be effective in killing the coronavirus. Okay, so as mentioned earlier, ones that will protect you will be using your alcohol as disinfectant, washing your hands, and drying your hands with paper towels, okay? And a clean, warm air dryer, okay? So it's not true. Even if you put your hands on the hand dryers, it will not kill the coronavirus. Okay, next, ito, again, some people would use the UV lamps to disinfect the hands. Kasi sabi, di ba, we use that to sterilize our things like the cell phones, the ball pens, or the things that we're using in the clinic. But it will not disinfect, it will not prevent or it will not kill the coronavirus. So it's a fallacy. The UV lamps will not kill the virus in your skin, but rather it will burn your skin. So it can cause irritation, it can burn your skin. So instead of using this, it's best to use still the soap and water. Okay. Next is ito, sabi nila in humid and like Philippines, having a sunny and hot weather, we are protected from having COVID. But the time will tell us what happened to us as we are increasing our numbers with the infected people by COVID. It's not true. So even if we reach the higher temperature of 25 degrees and above, we will not be protected from acquiring COVID infection. Another fallacy as well. Yung COVID-19 daw cannot be transmitted in areas of hot and humid climate. So the same, yung sinabi kanina yung 25 degrees and up, hindi daw will not be affected by COVID infection. But it's not true. So it can happen in cold temperature, in high temperatures. So coronavirus can thrive. Next is this is still the same with the range of temperature. So in cold weather or in those with winter, where yung winter ang kanilang setting, still the COVID can thrive. So yung sa United States, sa Canada, they still have COVID even if they have the extremes of temperature. So another thing, ito daw, okay, I think you have heard this, na yung 5G mobile network daw can transmit COVID-19. It can spread the virus by just turning your 5G mobile network. So it's not true. So the truth is, COVID-19 is spread through respiratory droplets and not by 5G in any way. It cannot be transmitted by 5G mobile network. Okay, next is ito, taking a bath daw in a hot bath would provide protection from coronavirus. So this is not true. Even if you subject yourself to the highest temperature, it will not protect you from acquiring COVID. So still, the things that we do, washing your hands, doing the social distancing, wearing the mask and the face shield, those are the things that will protect you, but not the high temperatures. Okay, next, ito. The coronavirus can be transmitted by mosquito bites. So it's not true. no study would show that the mosquito bites can transmit this virus. So still, the transmission is by getting in contact with the respiratory droplets of an infected person. Okay, so mosquitoes cannot transmit COVID-19 or the coronavirus. Okay, there was a time, I think, it was in Facebook that it went viral. There was a discovery daw in Italy that COVID-19 is actually not a virus, but a bacteria. So the study would show that it is really a virus. So it is not a bacteria as they had claimed. So this is not true. It was actually the mention that they were using antibacterial. Ang sabi nila, azithromycin was effective because it was discovered that it was a bacteria, but it's not true. So coronavirus is a virus, and it is not a bacteria. But the antibacterial that was used actually in those patients who are infected was working because they have superimposed bacterial infection, but not because it was discovered to be a bacteria. Okay, I think it was also, I think one of the actresses mentioned this, that she tested herself by making this, yung mag-inhale daw ng matagal, you inhale and then hold your breath for 10 seconds. And if there will be no episode of coughing, then you're well. So wala ka daw pneumonia. And it's not true. So no study would say that this is true. This is not a test whether you have pneumonia or you have COVID infection. So this is not true. Yung breath test na sabi nila, yung inhalation test. So it was not proven to be true. So COVID infection cannot be confirmed by just doing this breathing exercise. Okay, sabi nila with the shoe, di ba we are doing the foot bath because the COVID virus can be on the soles of our shoes and can be brought inside the house. So the studies would show that the likelihood of having COVID-19 infection being spread on the shoes and infecting individuals is actually very low. So it was just a precautionary measures because, like, if you are entering your house, even without COVID, we are not supposed to bring our shoes inside the house for the reasons that we are actually going around and we can step on different bacteria that we can bring inside the house. And then our children, our infants who are trying to crawl can get all these possible infections, but not specifically from the coronavirus. Okay, actually this is the same with the first slide that I showed also. Yung drinking methanol, ethanol, and bleach, sabi nila can prevent the infection of COVID. I think it was in the Philippines that we had in Luzon, the lambanog. Okay, they were trying to drink lots of lambanog because they say it will protect them. Okay, no studies have shown that it is working. Okay, so even it has, I think, caused some intoxication and poisoning when somebody was, I think, drinking methanol and it was contaminated. So this is not true. Taking of your alcohol drinks or taking of the methanol, bleach would make you protected from COVID-19. So it's not true. Okay, next, remember there was a invented machine wherein somebody entering a building would be sprayed with this disinfectants. So it's not true. It's not true that this will protect the person from getting infected. Remember, they are using disinfectant like chlorine, other harsh chemicals when they spray on the person. And imagine this disinfectant getting into our airways. So it will give the person more of a disadvantage than being protected by this disinfectants. Okay, next is the ito din house flies. So kanina yung mosquito bites. So mosquito bites, they're not a cause of transmitting COVID. So the house flies as well cannot cause the transmission of the coronavirus. So yung dalawa, mosquitoes and the house flies, okay, they cannot transmit the virus causing COVID-19. Okay, ito, the issue about using your mask while exercising. So I think it was also in the news earlier during, I think, the first quarter, that somebody who was using a mask was found to be having one lung collapse. So I think it was a hearsay. It was not really documented. So the World Health Organization opinion on wearing the mask during exercise is that they don't advise people to wear mask during exercise because it may reduce the ability to breathe comfortably. So it's more of a comfort. It's not because it can cause collapse of the lung, because the study will show also that even if you are using the mask and they measure the auto saturation, it is not different from when you are not wearing a mask. So it's the same. So it's more of like it reduces your ability to breathe comfortably, and as well as another reason is that sweat can make the mask become wet and more quickly, which makes it difficult to breathe and promote the growth of microorganisms. So ito yung reason why they don't advise the use of mask, but not because it will decrease the oxygen in your blood, or it can cause the intoxication of carbon dioxide. So it was not the reason actually why mask is not advised to be used during exercise. So what we advise is during exercise, you don't wear your mask, but you have to maintain the social distancing. So probably 2 meters or 1 to 2 meters from another person. And if possible, it's not within the enclosed, it's not indoors. It's best to do the exercise outdoors. Okay, so ito, thermal scanners, they say that it can detect COVID-19. So initially, it was thought that the ones detecting the temperature of those entering the malls would detect the infection by COVID. So it's not true. It will not detect the presence of COVID infection, but rather it's just detecting the temperature of the body. Okay, next is who are the vulnerable population. So they say that the older people gets the infection more than the younger people. But yes, it's true that there are vulnerable populations, which are the extremes of ages, so the elderly and the younger ones. But everybody can get COVID-19. So I think the data would show that it's not exclusive to those elderly people and not exclusive to those very young people. So it can happen to anybody. So it's not. It is just like there are groups of people who are more susceptible, but anybody can acquire the infection. Okay, so the fear that most of the people who acquire the infection will die. Okay, it's not true. So majority of those who are infected get well. So only a few would have developed the critical conditions leading to admissions at ICU, and only a few would die. So majority actually would recover. Okay, ito. It's the same with when you're using the mask for when you are exercising. So there was a belief also that when you wear mask, it causes the intoxication of carbon dioxide. So you would have carbon dioxide intoxication, or you can also have oxygen deficiency that when you wear mask, but it's not true. So studies would show, as I mentioned earlier, O2 saturation will not be affected by wearing your mask. So it will not hamper your it will not intervene with the oxygen that you are breathing. Okay, so itong vitamins, especially those containing zinc. I think it was during the second, I think March, there was a shortage of yung multivitamins with zinc. So yung Consays actually. So it ran out because probably of this misinformation that it will protect anybody or any if you take this vitamin, it will make you less susceptible to having COVID-19. But it's not true. No study would show that you'll be protected if you take this vitamin with zinc, with vitamins D and C, and you'll this will cure if you have COVID infection. So it's not true. Okay, again, ito yung hydroxychloroquine. I think this is also a controversy even at the moment. But studies would show also that it is not of clinical benefit. So if somebody is infected, the studies would show that giving hydroxychloroquine will not help the person recover. Okay, so unless some studies would come out giving us the data that it will show that it would really benefit the majority of the patients, then this will be recommended by WHO. But at the moment, this is not supported by studies. Okay, so a question now. Are there any specific medicines to prevent or treat the new coronavirus? To date, there's no specific medicine recommended to treat the new coronavirus. However, those with infection are given the supportive care. So there are treatments for COVID-19, the antiviral. I think there was a study disproving the benefit with this antiviral, but Dr. A will discuss further about this treatment. What are the treatments that are proven to be effective for COVID-19? How about antibiotics? So, especially azithromycin, I think this was the antibiotic which was rampantly being used, even without the prescription, they're taking this. But as data would show also, there was no evidence that this will work with the virus. Okay, just take note, it will not work with the virus. So probably the reason that an antibiotic is used because of a superimposed bacterial infection or a bacterial co-infection. Okay, so do vaccines, may ano kasi na time na, okay, you get your pneumonia vaccine because it will protect you from coronavirus. Okay, the reason that patients who come into the clinic advised to get pneumonia vaccine is to protect them from having pneumonia. So the reason that this is advised is because if a patient will have will be infected with COVID-19, you're sure now that the chance of getting the pneumonia from a bacterial cause will not be more of your problem, but rather you have taken away one of the other problem that you'll be managing by giving your pneumonia vaccine. Okay, this is also like, there was an advice before that when you go to public toilets, you have to close the cover before you flush the toilet. Okay, so it's not actually a common route of transmitting the COVID-19, but it was found that the virus can be found in our in the feces. Okay, so it was only a finding, but it was not really documented whether the coronavirus can be transmitted through that. Okay, drinking water will help you protect yourself from COVID-19. Okay, this is not true. But drinking water will make yourselves hydrated, and can your body will be functioning well with proper hydration, but it will not protect you specifically from COVID-19. Okay, so actually ito yung, this is not really, sorry for this slide, but it was just what are we going to do for us to be able to combat COVID-19. So the same as what was mentioned before by Dr. Aileen, social distancing, mask and face shield, frequent hand washing, proper hand washing, social distancing. So if you feel not well, then don't go to work. If you cannot do the test, then quarantine at home. So those things are just but simple, but we have to do our part. So if somebody is you think like a neighbor is asking you some of your opinion, then you can give the proper information rather than proceed giving the misinformation. So it's also just a reminder. Very simple: hand washing, covering your nose when you sneeze, and throwing your tissue away in proper container, and then wash your hands after that. Okay, so if somebody is sick, then don't let the person go to work or be with anybody. So this is actually my last slide.
Doc Raymond, nakamute ka, Doc.
Yeah, ako nga. Hello, Doc. Thank you again for that that informative discussion. You have clarified a lot of myths, a lot of fake news, or a lot of false information regarding COVID-19. Again, for our viewers, please, if you have your questions, we will be answering those before we end. Before we proceed to the next part, which is one of the most awaited segment of our discussion today, which is the updates on the current updates on the management and the search for vaccine, we will first have a short break. Okay. Please watch these videos.
It began with a vision of a man who believes in education. As an enabling force that leads to the enlightenment and transformation of individual in a society. What started in 2002, Jose Maria College, flourished and has grown into one of the leading institutions in this part of the country.
Best law school, offering the best facilities with the best teachers, yet offering it at a very low rate. And this is very unique, and we should give our thanks to Pastor Apollo Kibuloy for making this happen.
I would like to thank the school, the administration, and Pastor Kibuloy for opening up another law school after 54 years. This will be a good help also in the community, and for the next so many years we'll have lawyers, I'm sure, of quality education would be graduating from the Jose Maria College.
Yan, we are back. We are back for our next segment. And without further ado, I would like to give the floor to Dr. Lanaban to discuss or talk about the updates on the management and the search for the vaccine or for COVID-19.
Okay, good evening once again. So allow me to share my slides. Okay, so Dr. Nancy Alba earlier mentioned a lot of myths about the management and treatment of COVID-19. So don't worry, this lecture I think is very short. I'll make this short and sweet because as of now, again, for the management of this new virus, or this infection is still ongoing. So just for the information of everyone, we do have a solidarity clinical trial for COVID-19 treatment. So meaning the World Health Organization in coordination or cooperation with several hospitals in several countries in different continents, including the Philippines, and SPMC is one of the sites of this study. This is a study that focuses on the management on the treatment of COVID-19. So before I proceed, I would like to highlight yung sinabi ni Dr. Alba kanina that COVID-19 is indeed a viral infection. Although there are management that would include antibacterial interventions, our management in the hospital setting is that, again, supportive care on top of the presenting symptoms of the patient. Meaning, kung pumunta ang patient natin sa hospital presenting with pneumonia, you will treat your patient as a pneumonia patient. Kung pumunta ang patient mo presenting with acute coronary syndrome, or in short, parang nag-heart attack, so you have to treat your patient as a heart attack patient. Nagkataon lang po kasi the virus or the infection, we have to screen as mandated by our latest EO po sa city, that all admitted patients po, especially those who are subject for operation, has to undergo swabbing, RT-PCR po, para ma-screen for possible COVID infection. But nonetheless, the presenting symptoms of the patient should be addressed and taken care of. Okay, so let's proceed po. So this management is on top po sa standard of care natin sa pasyente. Okay, so treat them under symptoms of your patient, and then on top of that, you manage your COVID-19 infection. So, if you remember yung ating previous na mga slides, most naman ng COVID-19 patients, 50% are asymptomatic. So, these patients only need supportive care, meaning increased hydration, there was one study about supplementation of vitamin C and zinc. Actually, the reason or the po nito, yung kanilang latest evidence po is that its supplementation of vitamin C and zinc is beneficial for those who are, lacking with these minerals and vitamins. But for those who have already got all the vitamins and minerals from the diet, hindi masyado malaki ang benefit. But again, if you could see, madaming mga patients, if you know someone who was diagnosed with COVID-19, sinasabi nila, may vitamin C ako plus zinc, that is on the background siguro that the attending physician or the clinician is anticipating na pwedeng deficit ang itong patient na ito. But nonetheless, in our population, especially for immune-competent patient, not so much, but we still give it, Not a placebo, but again, it helps. Vitamin C, water-soluble vitamins, it is excreted. So anything in excess, kasi ang problem nito, most of our patients or in the population, nag-o-overdose. 3 grams ng vitamin C that could lead to renal stones. Ang nag-o-overload din ng zinc. So that is not the proper way to do it. So you just have to reach the yung recommended daily allowance of the vitamin C and zinc. Okay? So for this solidarity clinical trial, so ito po yung ating interim na results. So meaning, ito po yung last na na-publish last October 15, 2020. Nag-test po tayo ng 4 na gamot. So remdesivir, hydrochloroquine, tapos meron po tayong antiviral na lopinavir and ritonavir and interferon. In our setting in the Philippines po, especially in SPMC, we do have remdesivir, hydrochloroquine. Not so much with the interferon. I haven't heard it na sa SPMC. I don't know, maybe they will be able to include it. But since we are part of the solidarity trial, okay, ito po yung kanilang interim result. Meaning po, hindi pa yung final, but these are what they noted, these are the things that they've noted on the different testing sites. So, nakita po nila with all these 4 treatments, they have little or no effect on overall mortality, initiation of ventilation, and duration of hospital stays in hospitalized patients. Okay, therefore, what does it mean? So giving this remdesivir, hydrochloroquine, which is an anti-malarial drug, your antiviral, lopinavir and ritonavir, and your interferon should be on the discretion of your clinician. Ibig sabihin po, you have to evaluate the patient, okay, kung kakayanin ba niya na ang side effect ng certain na gamot, okay, before you can give this. So, but in totality, under the interim results that they have collated, not so much po yung kanilang benefit. So, although there are some that would claim that there is some patients, especially here in our setting, okay, one of our IDS is really convinced that remdesivir really works for those patients with severe or critical COVID-19. That's why we're giving it. Okay, and we are still going to collate our data and look into it, whether or not in our population and in our certain cohort patients, that if there is really a benefit or significant difference of when giving this remdesivir. Okay, but nonetheless, again, based on the World Health Organization, okay, these 4 treatments used in the solidarity trial, not so much on the benefit. Again, babalik po tayo ngayon sa standard of care and supportive care, addressing what is the symptoms present in our patient. And we have, I don't know if you have heard or na rinig ninyo yung cytokine storm and bradykinin storm. So these are 2 mechanisms wherein the immune system of the patient is very much involved in the complication of the COVID-19. So yung ating binabantayan po is the reaction of the body to the COVID-19 virus. Meaning po yung ating cytokine storm, your body release a lot of inflammatory cytokines or chemicals that causes your systems to haywire. Okay, bradykinin storm is it's a newer parang mode of complication or another complication that they looked into the COVID-19 infection na kaya namamatay yung patient because in the bradykinin storm, parang nagli-leak yung ating mga blood vessel. Okay, pag nagli-leak ang blood vessel, doon nakikita natin sa x-ray, merong mga fluids. So, ganun din. There are several complications that might be present in our patient. But what is important here, okay, if you could see in the lower part of the slide, meron po silang the WHO is looking into the development of newer antiviral drugs, immunomodulators, and antibodies. Although these are still on the earlier phases of the development. So medyo matagal-tagal po. Okay. So what about corticosteroids? So nasabi na po natin yung 4 na main drugs included in the solidarity trial. Ito po yung ginagamit sa Amerika, sa Europa, and all part of the world na included sa study. Okay, so no, very little or no benefit at all for the mortality, okay, of the patients. But again, the caveat here is that you have the clinician, the doctor, has to really decide whether or not the patient is a good candidate for these drugs. Okay, so let's proceed. Yung pinaka-famous na corticosteroid, nung nag-release sila na may initial study that says there is increased benefit in giving steroid, natakot yung mga doktor baka kasi ma-overuse yung steroid. Okay? In our locality, overuse for joint pains, no, yung ating dexamethasone, okay, or commonly known as parang wonder drug, because pag ininom mo siya, it's a very potent anti-inflammatory, nawawala yung sakit. Okay? So yung common name is Decelone. A lot of elderly patients with osteoarthritis sometimes will overuse these drugs. Okay? But again, caveat from the WHO, the use of corticosteroid is still going to be based on the clinical judgment and the assessment of the patient. Because if you could see, ito po yung sinabi ng WHO. We recommend systemic corticosteroid for the treatment of patients with severe and critical COVID-19. So we suggest not to use corticosteroid in the treatment of patients with non-severe COVID-19, as a treatment brought no benefit and could even prove harmful. So remember, your steroids can not only have an anti-inflammatory effect, it also lowers down your body's defense, because again, ilo-lower down niya yung defense, kaya hindi tayo nakakagawa ng inflammatory cytokines. Okay, may inaatake po yung, or tawag nito, may pathway po na binablock ng steroid. Okay, so what does this slide tell us? Again, IV corticosteroids are only beneficial for those patients, okay, na critical or severe or needs intubation. But for those asymptomatic, mild, okay, or those moderate with no need for ventilatory support, the benefit of corticosteroid is not beneficial. Okay, nonetheless, it could also be harmful pag binigay natin sa mga patient if we don't know if there is any underlying comorbidities. Okay, like in patients with diabetes, pag binigyan mo ng steroid, mag-uncontrolled diabetes yan. And we know that diabetes is one of the comorbidities, okay, that could further put the patient at risk for severe COVID-19 complications. Yan, ito na po yung sinasabi natin na based po yung kanilang statement ng WHO that is based on the recovery trial. Okay, it was initially performed, or it was performed in the United Kingdom. So again, benefit lang po ng corticosteroid, IV corticosteroid, hindi po oral, is that for those patients, okay, with severe or critical na COVID-19. Meaning, ito po yung patient na hingal na kailangan pong tubuhan. Okay, how about COVID-19 vaccine? So, as a background po, ito po yung steps ng COVID-19 development. Okay, meron tayong mga preclinical studies, clinical trial, phase 1, phase 2, phase 3. Ay, yung naririnig po natin ngayon with the news is the phase 3 trial. Wala pa po tayong phase 4, but there are some, okay, few manufacturers who are rather going into phase 4 or the post-marketing surveillance. Ito na po yung parang bibigyan ng license yung vaccine at saka i-distribute na. And then monitor those patients who have been given the vaccine and look into parang prospective cohort study. Titignan, susubaybayan po yung mga taong nabigyan ng vaccine. Baka kasi may komplikasyon later on, 1 year, 2 years, or any adverse reaction thereafter. Okay? So, a caveat here, or a vaccine na parang natin, kung makikita po natin at the bottom of the screen, currently there is no FDA-approved or authorized vaccine for the prevention of COVID-19. Madami pong mga potential vaccines in the market now, or yung mga undergoing phase 3 trials, but none of them are given FDA approval yet, okay, as of now. Okay, so maybe in the coming days, may lalabas na. But again, phase 3 clinical trials ang natapos ng vaccines na ito. We are still going to look into the phase 4 or the post-marketing surveillance of these vaccines. Okay? I know this is quite, kumbaga, a concern in our country because of our Dengvaxia. Dengvaxia in itself, a vaccine which is good for dengue. However, medyo nagka-problema talaga sa atin because the way we gave it to the population or the cohort na mga patients, hindi masyadong napag-isipan. Okay? So usually po, kung makikita natin, okay, this is how the vaccine, okay, are being developed. So traditional vaccine development, it will take years. Okay? So usually, kung makikita natin dito, phase 4 will probably occur on the 10th year. So it will take several years, 1 to 2 years per phase. But because of the dire need, okay, of vaccine for the pandemic, ang nangyari po is nag-accelerated vaccine production. Okay? So ginawa natin yung preclinical, phase 1, phase 2, more or less on the same year. Diba? Nag-start tayo early 2020 and then we are still, okay, on the 9th month, especially here in our country, 9th month of the pandemic, may naririnig na tayo na phase 3, which is quite early pa talaga, no? If considering the usual duration of developing a vaccine. Okay? So ito, pinamadilian, but we have to be sure that we scrutinize the phase 3 result because once we are already in the phase 4, post-marketing surveillance, ang tinitignan na lang natin doon na yung side effects. Okay? And paano na yung nabigyan? Okay? So that's one of the things that we have to look into or i-consider natin. Okay. So based on the WHO, okay, so as of October 2, we have a total of 42 COVID-19 candidate vaccines and 10 of them are already in phase 3 trials. So there are another 151 vaccines, okay, they are still in the preclinical evaluation, so it will probably take them months to years before they can proceed with the phase 1 to 3. Okay, so on the phase 3 trials naman po, requirement is 30,000 or more participants. So you have to look into these cohort na patients and then before we can proceed or we can have the initial result or the result for that phase 3 trials. Okay. So we will focus now on 3 vaccines. So for the last week po or week or two, we have 3 vaccines that have released an interim result. Okay? Let's start po sa Moderna vaccine. Okay? By ito po, second to the last, Moderna vaccine. So this is a RNA. I will not discuss the mode of action na lang po kasi medyo madugo. But nonetheless, for the Moderna vaccine, they have released an interim phase 3 result na po. And they claim that it is 94.5%, no, effective in preventing COVID-19 infection. So when itong Moderna vaccine, okay, na ginawa nila sa US, released their interim result, nag-release din si Pfizer. So Pfizer, if you could see sa number 10, si BioNTech, Fosun Pharma, or Pfizer, the same po din na vaccine platform, RNA. Ang kanilang testing site po is US, Argentina, and Brazil. They also released, but sa Pfizer po, they released a parang final or conclusion for the phase 3 trial ng kanilang vaccine. Okay, so they claim that they are 95% effective in preventing COVID-19. However, ang caveat po nito is that they don't have the data to back up the claim. So we are still, I think they have published the protocol of their study, and a lot of mga researchers are looking into it just to make sure how they came about the conclusion of the 95% effectivity rate. Okay? But nonetheless, itong ito po yung Pfizer, they will have a parang pilot na po na distribution of the vaccine, okay, in the 4 states sa Amerika po, Rhode Island, Texas, New Mexico, and Tennessee. Okay, and they are pushing for the US FDA na approval. Okay, we are still going to wait for that and listen, and probably in a couple of days baka ma-news na if there is already FDA approval, and then if there is already the start of the phase 4 trial. Okay, that was November 20. November 23 po, the recent one. Okay, ito po yung ating Astra or Oxford na group. So, if you could see here po, the 4th one, okay, the University of Oxford or AstraZeneca, different ang kanyang viral platform. It's using a viral vector. Okay, and they release an interim, meaning po initial phase 3 na result. So they have noted, okay po, na ang kanilang initial na vaccination wherein 1/2 dose is given on the first day and then another 1 full dose of the vaccine given after 1 month provides a 90% okay, na effectivity in preventing COVID-19. That was in the US, done in the US na study. However, their testing site in Brazil, okay, ang ginawa nila na instead of 1/2 dose of the vaccine, ginawa nilang 1 dose, full dose of vaccine on day 1, and then after a month, they gave another full dose. The effectivity rate dropped into 62%. Okay, so ito yung medyo may, they have to really look into this. Nonetheless, okay, titignan nila bakit bumaba yung kanilang effectivity versus just using a half dose in the US na cohort group. But nonetheless, this interim result by the Astra and Oxford group would further push them, no? Pag matatapos na po yung phase 3, would push them to provide more vaccines. Ang target kasi nila is the third world country. But of the 3 companies po na na-mention, ito po yung mga latest na updates nila. Of the 3 companies, the AstraZeneca verbalized that they will, once the vaccine is approved, US FDA or FDA approved, and distribution or mass production of the vaccine is being started, now the price of the vaccine would only be at cost, meaning they will not, hopefully, okay, if they will push through with their words, they will not produce the vaccine for profit, but nonetheless, it's just going to produce it, and the price would be only at cost based on how much they just spend for the production of the vaccine. Okay. So yun po yung ating last na mga updates. But again, I go back kasi if you notice po with the COVID pandemic, we have a lot of trials. So far, the trials, some would be beneficial to some group of patients, some would not be beneficial, okay? And we cannot emphasize more on the prevention aspect of this pandemic, okay? So prevention definitely is better than cure when it comes to COVID-19, because we don't want na at the end that the law of natural selection will be the only one that will dictate whether you survive or not, okay? So hindi natin alam who is susceptible, although there are studies that immunocompetent adults, okay, 19 to 50 years old are more or less are able to be able to survive COVID-19, and most of them would present to be asymptomatic. We don't want to get that chance because honestly, okay, we do see a lot of patients early 30s dying because of COVID-19, and we see, me personally, I know a patient we've handled who survived COVID-19 at the age of 82. Again, do not be complacent. Be always on your guard and be always concerned about not only yourself but your family members, especially for those who are not immunocompetent, or those who are elderly, or those who are very young. Okay, so reiterate ko lang po yung bida solusyon ng DOH, which they are really pushing forward, na maging bida tayo lahat, to always wear our mask, sanitize our hands, make sure that we do keep the social distancing, and always update ourselves with yung relevant at saka real po na information, and not just the information we get, number one, sa Facebook. We always get that, ang daming mga rants. But again, make sure that your information, the information that you are feeding yourself, is really from a reputable na source. Okay, we have DOH na website naman. You can always go back there, look into it. SPMC, meron tayong website, look into it, or WHO. Okay, and with that, I thank you for your attention.
Thank you so much, Doc Aura, for that very informative update. No, I myself, ang dami ko natutunan with that segment. So we will be before we go to our last segment, which is Q&A. We will be collating the comments and the questions. But before that, let us pause for a short break muna. Okay.
bahaghari. Liliwanag muli sa'yo, huwag ka lang sumuko. Matatapos ang unos na may bahaghari.
Okay, that was an original composition of one of the JMC student, Bahaghari, matatapos din ang unos. So, okay, let us proceed now to our Q&A part. So, the questions, I will be reading the questions, and our resource speakers, Dr. Aura, Dr. Hugo, and Dr. Nancy will be answering those the queries from our audience. So first, let us flash the questions first. I will be reading also some of the comments. Maganda yung feedback natin from the audience eh. Sabi ng isang audience from si Kazi Lorenzo. Marami akong natutunan dito. Please do more programs like this. Thank you so much. Ako din maraming ako natutunan from our speakers. So we'll try to organize more programs like this, health related programs to open to give access, to give information to the public. So another question, may question tayo dito. Sandali. Yan. Si Dr. Arancel, ang comment niya, through YouTube, I would like to welcome everyone to this panel discussion brought to you by the JMC and faculty. Let us all work to overcome these challenges that we are facing every day. Thank you. Okay. So another comment or question would be, yan. Good afternoon po mga doc. Thank you po for this. From Hamida Olensay. Yeah. Ayan. Let us, we have the question here from this is L.U. Cesar Hugilon, one of our medical students in JMC College of Medicine. For the frontliners, doc, especially those employed in the public institutions, out of pocket po ba yung expenses for cost of treatment if they are infected? So, can I call on Dr. Aura to answer this one?
Yeah, that is one po, Doc. If you notice sa aking presentation, we have a lot of health workers being infected with COVID-19. So those who are asymptomatic are being admitted sa mga temporary na facilities natin. So SPMC being a DOH retained hospital, okay, we yun kaya na-hurt kami sometimes that we see in the Facebook that we want na maraming COVID-19 because we get from PhilHealth. And the reality is that since DOH retained hospital ang SPMC, we maintain the zero balance billing. So lahat ng na-admit sa ating institution, health worker man o hindi, okay, na-admit sa ICU or sa ward, zero balance billing po yung kanilang end na bill. Okay, now if there are complications talaga and they stay a very long time, we have patients staying more than a month or prolonged into ventilatory support, okay, ginagawa namin, ganun pa din. We, aside from the subsidy of the hospital and zero billing, we may mga financial support po. So, more so for the frontliners, our DOH, okay, Department of Health, pag frontliner ka na-infect ng COVID-19, so long that it is in the line of duty, okay, they will provide financial support depending on the gravity of the COVID infection. And again, if you are SPMC employee, of course, zero balance billing yan. Okay, so yun lang yung good thing. Even before in the early stage, we have healthcare workers from the private institution at being admitted at SPMC. As much as possible, or most of them, zero balance billing po. So wala silang nababayaran. Okay, what they usually siguro ma-out of pocket is that if they stay in the hospital, may kailangan bilhin, they want something to eat, for example, na hindi included sa aming dietary, they can ask their family to send it sa hospital. So yun yung mga other siguro expenses. Okay, but the basic na mga management, they are provided by the hospital if they are available, and then at the end they need not to worry for the billing, because aside from the zero balance billing, there are some naman tayo, meron tayong lingap, meron tayong Office of the President, meron po tayong malasakit center that could also help.
Okay. So no, thank you for that. Thank you for that, Doc. At least na-clarify that there is no truth o walang katotohanan that doctors and hospitals are profiting from COVID-19. No, kasi medyo nagiging issue siya ngayon, and it's hurtful nga to the frontliners that we are being accused of that. So,
Doc Rames, as addition lang, kasi initially when we started, di ba, the SPMC lang po yung COVID-19 na institution that is allowed by the DOH to admit. But because nga nag-surge at saka overwhelmed ang SPMC, there are already private institutions that are opening up. Ang requirement ng DOH, I think 20% of their bed capacity, they have to, allot it for COVID-19. However, as to, yun nga lang, if private institutions, they are still on process for PhilHealth claims. Kasi as of now, yung PhilHealth claims po for COVID is only for yung government-retained hospitals and not for private. But they are now, since they have mandated naman na private institutions, then the COVID-19 na PhilHealth case rate would also be applicable sa mga private settings.
So, okay, Doc, thank you for that. So, basically, sa SPMC, which is a DOH retained hospital, you are ini-observe talaga yung zero balance billing, di ba? So, unless na lang, unless na lang gusto ng Jollibee or McDo yung patient, so siguro yun yung out of pocket, di ba? Pero most of the expenses or the cost is covered by the government. Thank you for that. So, next question, Doc, we have question from Cassie Lorenzo. Posible ba na ang arrangements ngayon will become permanent? Should we get used to all this new normal? So, sino ko kaya siguro si Doc Nancy? Can you give your insight?
Okay, with this question, I think it will take us some more time. The vaccine will be coming in probably the earliest to be March next year. That's what they say. But after that, the problem is, will we be getting enough vaccines for the population? So that would take us probably another year. So they're saying it would be like for the next 2 to 3 years, and maybe even more than that. So probably, you can think about it like semi-permanent, but I mean, you can get used to the new normal. Always doing the wearing the mask, the face shield, social distancing, hand washing, and be responsible. Like if you don't feel well, stay at home and don't go out. Yun lang naman ating contribution. We should be responsible for ourselves and for our loved ones and for other people. Kasi nga, when you're working, like in our setting, some of our employees, staff, will be having drinking spree. And then, one day, yung isang kainuman, kasi di ba yung one glass lang ikot-ikot, parang anong tawag niya, tagay. Okay, so one of them got positive. So ang problem ngayon, yung staff namin, we were exposed to him. So kami, syempre, kinakabahan. But I mean, it started with the irresponsible person during this COVID time, taking alcohol, drinking with yung friends within the neighborhood, and then it turned out may positive. So, yung ganon, let us be responsible. It can take us 2 to 3 years, maybe even 5 years. But what we can do is we can contribute to this pandemic in our own ways. Not the big things, but in our little ways.
Yeah, thank you for that insight, Doc. Talagang no, one lapse lang ng isang tao will really cause a great impact to everyone else. So, Doc Aileen, do you have any insight din dito, Doc? Especially in the field of sa workplace. Ano yung mga nakikita natin nagiging problems in the workplace? Common problems na in the workplace about observing this new normal or the precautionary measures.
Ay, Doc. Firstly, yung ginagamit po na index when, example, you have a COVID-19 patient, no? May nadiagnose. Usually, the index na ginagamit, Doc, is 37. So, 1 times 37. About 37 ang pwedeng nakakontract ng virus. So, yun yung computation na ginagamit even ng CHO. So, sa workplaces naman, actually yung pinaka-problem talaga, Doc, or yung sa ni Dr. Alba, yung myth. Madalas kasi talaga, most of the employees kasi talaga, nandun yung iinom para mawala, para hindi makakuha ng COVID, iinom, mag-drinking spree, totoo yun. And then, yung paggamit ng PPE like yung mask, ayun, kahit nandiyan na sa harap, nakapaskil, hindi sa baba pa rin. Yung talagang nahihirapan kami dun sa, when it comes to workplaces. They believe in, kasi, set of myth ba na talagang ang hirap buwagin. Yun ang mahirap. So, siguro, we will strive for more awareness and education campaign kasi talagang mahirap. At saka mas may Dr. Google at Dr. Facebook na ngayon. So mas naniniwala sila dun sa mahirap talaga ma-explain.
Yeah, yun ang mahirap. So I think this is one of the platforms that we can use to disseminate awareness, information and improve awareness. So pero challenging talaga to break the myths. So maganda na natakal yun kanina. So in line with that, Dr. Lilibet Araniego, one of our faculty and has a comment about the question by Cassie Lorenzo. So sabi ni Doc Lilibet, we have to get used to the new normal because we have to continue living our lives. No one knows when this pandemic will end. We only have lessons from the past to refer to. Spanish flu in the earlier century ended a few years. So, yan. So, again, at least from lessons from the history. So, it may take years. So, let us continue to observe precautionary measures.
Dr. Mon, if I may add, another challenge din kasi when handling companies is trying to convince the management na yung program mo is really beneficial, no? But naiintindihan naman kasi there is a cost implication for the programs. But then again, if you really want to curb the pandemic, the Occupational Safety and Health Committee and the top management must really work hand in hand.
Yeah.
Thank you.
So kailangan kailangan both the healthcare sector and the economic sector would help would help each other para makombat natin itong So next question from Shine C through YouTube. No, in your assessment, how long still will the current situation last? When can we all possibly go back to normal schooling? Gusto niya na siguro makita yung mga friends niya. No, I think nasagot na tong question na to. It may take years pa na makabalik tayo sa new normal. On the normal schooling, difficult to say pa, Doc? Parang same ng question kanina. So it was answered before. So si Giovanni de la Cruz, nag-comment siya, stay safe everyone. So stay safe. And another question from Shine C. How true po na effective daw ang tubig steam bath to prevent COVID? I think this was answered by Dr. Nancy kanina, no? Pero kasi very, ano siya, very controversial siya na, ano, na management because of what happened in a certain place here in the Philippines. So, I think nasagot na to na there is no evidence, diba, Doc Nancy, right now?
Yes. Yeah, at the moment, no evidence would point that this can prevent infection from COVID-19 or it can cure you from COVID-19. But what they're having, I think, with limited documents would be that it will make the recovery from the common colds early.
Yeah, okay. So, at least we have answered that, that certain question. So, the next question would be from Ben AD, Doc Ben, si Doc Ben. Doc Ben dato dalan. So, hello Doc, are there any data from the local psychiatrists or any mental institutions disproving skeptic claims that the invincibility from COVID-19 of freely wandering mentally ill patients not wearing any protective gear or to the very least face mask is proof that this pandemic is hoax? So, bali, parang follow-up question to, no, that many are saying that this is a hoax, the pandemic is a hoax, tapos it is a scamdemic daw. So, do I have data from that, from local psychiatrists? Or anyone pa? Meron na po. I think, as early as of now, para kasi sinasabi nila na parang yung mga vagrant, yung mga nandiyan lang sa kalye, hindi naman daw nagkaka-COVID-19. So, or yung mentally ill na nag-wander freely lang, hindi naman nagka-COVID-19. So, hoax daw yung COVID-19 because of this. Hindi naman sila nagsusot ng face mask or whatever, pero they're safe. So,
comment. Okay. The fact that a lot of people are dying from COVID-19 would really document that it is not a hoax. Okay, this is the reality. This is really true. And probably the reason why these people are not getting COVID-19 would be from a lot of factors. Probably they're observing social distancing. They're not wearing masks, but they are in social distancing with other people. And probably also, I mean, their body has been accustomed to all these negative impacts. The environment are getting them, making them stronger, probably. But I mean, these are not documented results. But a lot of factors will be contributing to this. Not only that, because they're not wearing masks.
Yeah. So we may not yet have the data regarding that, pero a lot of factors may come into play. Ganun ang kanilang immune system. Mas malakas ang immune system. So, ayun, Doc. Let's actually there is a comment on this by Doc Lilibet Araniego ulit. Let's read this comment from Dr. Araniego. Because this is a pandemic with a novel causative agent, then there is scarcity in data. However, if the issue is if this COVID is a hoax, what kind of proof do you need when the whole world's economy have been crashing down? Even the strongest countries, the richest ones, have been affected. Boris, Donald, and who else had it? So these are the leaders of the first world countries. This is not a hoax po. Let's together heed the call to help curb the pandemic. Thank you for that comment, Dr. Libet. So, no, even though we don't have much data, the whole world is suffering. Suffering from the pandemic is proof enough. So, sabi ni Doc Ben, very informative. Thank you for that, Doc Ben. So, we have another comment from Mr. Rogelio Ambrosio. Ayan. Thank you for a wonderful discussion, doctors. This is very timely because we hear so many things about COVID-19. Thank you for the clarifications. That's what. Thank you for this comment, sir. That's why we are here to clarify many misconceptions on the COVID-19 pandemic. So, ayan. Nasabi ko na dito, kasi Lorenzo, marami ako natutunan dito. Please do more programs like this. So, nagtanong ko how much, eto, si Doc Ben, what parameter, next question, What parameters should we expect to unfold and be practiced to assure that the Filipinos or any third world country will not be subjected as guinea pigs for any phase 4 approved vaccine? So, ano yan? So, this is a very, parang controversial kasi, so, ano kaya
I think the WHO has put the safeguards for this. I think they have the so-called yung COVAX. They will have to every vaccine that will have to be provided to the population should go through that quality check. I mean, this will safeguard and make sure that those who are subjected to the phase 4 phase of the vaccine will not be just mere guinea pigs. Okay, so may safeguard naman tayo through the WHO.
Most likely we will be having standards and guidelines for this. So, let's still have an open eye, parang vigilant. Let us also practice vigilance on this. So may comment si Dr. Dahlia, our Dean, Dr. Dahlia Arancel, regarding the vaccine. The challenge now is how to transport the vaccine that needs negative 70 degrees Celsius to be effective at the time of injection. Storage and transport of the vaccine are now the main challenges to tackle. So after ma-release yung vaccines, there will be a lot of challenges, especially itong cold chain, no? So that the vaccine will be effective, kailangan at a certain temperature. Medyo challenging to. So,
but I think the Astra would only require 2 to 8 degrees centigrade. So Astra would be our best chance.
So, I hope siguro while on development, ma-improve pa nila yung formulation nito na it would not need that kind of temperature. Medyo mahirap talaga siya. So, sa Astra has parang lower requirements for cold chain. So, okay. Doc Lilibet has a comment. Ito yung question with the tuob, yung steam bath. Tuob can also be dangerous because it may aerosolize the virus in the steam and spread in the household. So be very careful then in doing tuob or in steam bath kasi pwede nga ma-transfer. Okay. So, sabi ni Doc Lilibet again, the vaccine, the guinea pigs have already been tested during the phase 1, phase 2, phase 3 maybe. Hopefully. No? Meron talagang to develop this vaccine, meron talagang people that really will have to, technically parang, will have to sacrifice so that we ensure na effective ang vaccines. So, okay, there are no more questions from the comments. So I think that ends our discussion for we started afternoon ngayon, gabi na. So before we end, I would like to thank our resource speakers, Dr. Rhea Lanaban, Dr. Aileen Polinar, and Dr. Nancy Alba for sharing their expertise on the topic COVID-19 updates. We are hoping that we will be able to provide more programs like this to increase awareness, to provide public health service through information dissemination. So, to all our viewers, thank you, and we hope that you have learned a lot, like me, on this topic, on this discussion. So, with that, without further ado, we would like to bid our viewers and goodbye. Thank you very much.
Thank you.